This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about arts and medicine, part 2. In the last episode, we learned about Mayo Clinic's Arts at the Bedside program from both an artist who visits patients and a patient-turned-artist. This episode, we're broadening that conversation to more ways the arts can support healthcare and healing. First, we're talking with Dr. Shelley Noland, a hand surgeon at Mayo Clinic in Phoenix, Arizona, who is also the medical director of the Center for Humanities and Medicine and a poet. Then, after the break, we'll hear from Tane Danger, an improv performer and Mayo Clinic artist in residence, about what happens when doctors do improv. But first, Dr. Shelley Noland, welcome to the show.
Thank you. Thanks for having me.
Now, Dr. Noland, you are a hand and peripheral nerve surgeon. What is that?
So I am a plastic surgeon, but I specialize in hand surgery and peripheral nerve surgery. So anything that could go wrong with the hand or wrist, I would take care of. And when it comes to peripheral nerve, it's really any nerve outside of the brain and spinal cord that could have a problem, such as being pinched or have a tumor on it where a nerve was injured. And that includes bringing life back to patients who have paralyzed arms.
Wow.
One of my areas of expertise.
That is incredible. But the main reason we're talking with you today is about a different kind of incredible work that you're a part of. You are the medical director of the Center for Humanities and Medicine. What made you feel called to combine humanities with your work as a medical superhero professional?
I'm sure you're aware with all of the physicians that you meet, the long journey that medical training is. And I think that doctors, we tend to get in the rut of, okay, let's take that next achievement. Let's check that next box. And I think that I'm not alone in this. When physicians reach kind of that 5-10 years out in practice, that's when we start asking those questions like, is this all there is? I've mastered the clinical care. I can do the surgeries, but it feels like something else is missing. For me, that really coincided with COVID pandemic.
Mm-hmm.
And I found myself having a little bit more time and starting to ask some more of those questions. And the way I integrated with art was through poetry. And I began writing and taking classes. And through poetry, I found the humanities and medicine overall. So was able to get involved and then became the chair of our Humanities and Medicine Committee and the medical director for the Center for Humanities and Medicine.
And how do you feel that poetry speaks to or enhances your medical career?
In medicine, we have to get comfortable with the gray zone. Everything's not black and white. There's a lot of ambiguity. There's a lot of not knowing that we have to tolerate. Poetry allows for that because it helps us find words for things that we have a hard time expressing. Doctors want to be correct. We want to be perfect, but poetry gives us that space to not be perfect and a space where we don't have to know all the answers and it doesn't have to be correct or right.
Yes. Let's talk about the center more broadly. The center's mission is to integrate arts and humanities into the healing environment. What are some of the different types of art programs you have available?
We have 3 centers across the Mayo Clinic enterprise, and each center offers programming. One of the biggest programs that we offer is Bedside Arts. So this is actually arts being done at the bedside of the patient. We also offer musical performances. We offer medical education programs such as a distinction in applied medical and health humanities for medical students. We do staff retreats. We do staff workshops. We actually teach continuing medical education courses. Really, the sky's the limit on what humanities offers because there is so much.
How do the arts and humanities help practitioners be better at practicing what they do?
I think art allows for us as practitioners to be better observers of the patient. And that's really important when, looking at a patient and trying to figure out what the problem is, what's going on. It improves our communication skills and improves our self-awareness. Participating in some of these arts helps team building, gives us that space for self-reflection so that we can really bring our whole self to work. And at the same time, decreasing burnout and stress from the provider
Mm.
perspective.
Let's shift now over to talking about how the arts and humanities help your patients. So, bedside arts, let's talk about that in particular. How have you seen bedside arts help patients through healing, through the mental challenges of being a patient, and so on?
There are many ways that the arts help patients who are inpatients in the hospital, and that is through bedside arts. The main ways that that's incorporated is going to be through music engagement, through the visual arts, movement-based work, or reflective writing practices. Studies have shown that patients who see nature or art from the bedside recuperate about 1 day faster than those who don't. And they also use
Ah,
fewer pain medications. And so that's just one objective finding of how incorporating the arts can be better for the patients overall, can also save money for healthcare in general. The cost of 1 day in the hospital is more than $2,000. And you apply that to every patient in the United States who spends a night in the hospital, that is over $56 billion that potentially could be saved by incorporating the arts and the humanities into that space.
wow.
In addition, studies have shown that incorporating the arts will decrease stress for patients, will increase their immune system. This has been even shown, for example, to decrease viral load in patients who have HIV after participating in a humanities-based intervention. It will decrease depression and increase memory and cognition. And so there's almost limitless benefits to incorporating art into the actual care of the patient. And there is objective data now where we can look at these physiological markers and findings like blood pressure, like lab results, and see how these can be impacted by incorporating the arts.
That's incredible because I'm sure some folks out there are thinking, like, why do I need that? And you're talking about improving the care for patients on both a measurable and not measurable level. How do you, Dr. Noland, personally talk with your patients about integrating arts and humanities into their care?
One thing that we really try to do, particularly if the patients have an interest in the arts or if they're musicians, is incorporate that act into their therapy. For example, if a patient has hand surgery, a major component of hand surgery is actually the hand therapy with occupational therapists after surgery. And what we have found is if we can incorporate their art activity, whether that be playing an instrument or painting or sculpture, into their therapy, that they A, are going to be much more likely to do it. B, they're going to be happy
Mm,
because that is their lifelong love. And I believe they will have better outcomes because they're really invested in their therapy at that point. And they also see how that's going to get them back to the meaning making in their life.
that makes so much sense. Can you give a specific example of how you've seen the arts or humanities affect either a patient or a practitioner for the better?
The patient that comes to mind for me was a transplant patient here in Arizona, and she had a very prolonged course after a liver transplant. And one of the things that she enjoyed doing was origami cranes. And while she was here in the hospital, she ended up making 1,000 origami paper cranes in
Wow.
all shades of pink and purple. And we created a display of these origami cranes in the transplant area gallery for all patients and staff to see. It was
Mm,
really beautiful to walk through that area where they're all hanging from the ceiling.
wow.
And then when the exhibit ended, all of the origami was taken down and distributed to all the staff members in the transplant area. And I have some sitting in my desk now. But I think that is really a great story because that benefited the patient, that
Hmm.
benefited all of the community that she worked with. It also benefited the staff, and it also benefited the other patients in that area who got to know her and received cranes as well.
That's just paper and creativity, and it really changed her experience and changed it for those around her. Now, we've talked about the benefits of humanities in medicine, but if someone point blank asks, somebody who doesn't know, why are arts important to medicine? What do the arts even have to do with medicine? What do you tell them?
The reason is that we need to take care of the whole patient rather than just trying to solve the problem. Like, here's the problem, here's the solution. That doesn't tell you the whole story. Really, we need to look not just in that one direction, but what is important to the patient, what's meaningful to the patient. I also think that hospitals nationwide are starting to recognize this. You know, more than 50% of hospitals have arts programs now. It's not just at Mayo Clinic. And especially as technology advances, I think the humanities sort of anchors us and keeps us grounded. At the center of healthcare is still the human. And we don't want to lose sight of that as we make all of these technological advances. I definitely think art helps with building bridges. I think that it can be viewed as a more pleasant activity, as you mentioned. Drawing or coloring or listening to a musician in your hospital room can get you in a different headspace. I've had patients write me poems, which is really wonderful to have something like that. There's a project going on in Florida looking at social prescribing. Outpatients will be prescribed activities through the Humanities and Medicine group in Florida. Let's say a patient has breast cancer and they go into a breast cancer clinic. There may be on the table there in the waiting room a book of poetry written by a breast cancer patient. Provider may give them a quote unquote prescription for a poem that they think relates to what the patient is going through, which might help give some language to something that the patient may have a difficult time communicating. Obviously, we're not replacing medical care, but as an adjunct to medical care, humanities prescriptions are being found to be effective and beneficial in that area. It's small, but it's growing.
I keep thinking of that quote from Dead Poet Society. Medicine, law, business, engineering, these are noble pursuits and necessary to sustain life. But poetry, beauty, romance, love, these are what we stay alive for. So I think what you're doing is just such fantastic work. And you have the stats to prove it. Thank you so much, Dr. Noland.
Thank you.
Art is so much more than a way to pass the time. For medical providers, the arts can help them learn to be comfortable with ambiguity, listen better, think about patient care more holistically, and avoid stress and burnout. And when it comes to patients, research shows that the arts can help folks recover more quickly, experience less pain, boost their immune systems, improve their mental health, and become more invested in the healing process, as well as lots of other tangible and intangible benefits. Many hospitals are now recognizing the powerful role arts and arts training can play in their ability to provide care, which brings us to our next guest. Tane Danger is an artist in residence at Mayo Clinic, and his medium is improv performance. Tane Danger, welcome to the show.
I am so excited to be on the show. Thank you for having me.
At Mayo Clinic, you are the inaugural Dolores Jane Lavin Center for Humanities in Medicine artist in residence, and your medium is improv. We're going to talk about what this job is, but first of all, for those who might not know, what exactly is improv?
Improv is this amazing, beautiful art form where people come together and they create a performance where nothing is scripted ahead of time. Everything is made up on the spot, completely off the top of their heads. And that requires a certain level of creativity and communication and thinking on your feet, which is really pretty amazing and beautiful to watch.
And all of that stuff is useful in such a wide variety of situations, which brings us to your artist in residency role. It is, according to the job description, a role that is supposed to enhance the healthcare experience by integrating the arts and humanities into clinical practice, education, and research. Explain what that means.
My notion is that improv is teaching us how to communicate, how to listen really well, how to collaborate with another person, how to think on our feet. But specifically in this healthcare space, we are using improv as a training toolkit for folks to experiment with. How do I listen to a patient or a colleague as we are trying to navigate something together? And maybe that's a simple patient interaction just in a regular visit, or maybe that's something in a surgical setting where it is high stakes and things are complicated. If we have someone in a medical setting who isn't listening really well, that can create all kinds of issues and problems, whether they are not listening as much as we would like to the patient or to the rest of their medical team or to other folks. And so practicing that, how do we listen? How do we stay open and engaged? Similarly, like how we collaborate with each other and how we think about the give and take of any kind of situation, absolutely fundamental to how we think about improv and how we can do healthcare extremely well. But that give and take, that good collaboration, it's not something that just sort of happens automatically, right? Like it's something that we have to practice and practice in a variety of different ways. Like, okay, when do I step forward? When do I lean back? When do I step in to support somebody else? When do I take the lead? That's easy to say, but that muscle of how we actually do that is something that we need folks practicing from the moment that they enter medical school all the way up through their entire career in residency, every single step of the way.
So how did this collaboration come to be? Because you and I can say intellectually, there's obviously something in improv that we can all benefit from, especially in a medical setting. But how did medicine and improv come together?
There is a very long history of this. Some folks might be familiar with Jane Addams, a pioneering individual doing social work in Chicago. She, in the early part of the 20th century, was working with primarily children, and she would take exercises out of the world of theater as a way to help children, particularly children from disadvantaged backgrounds or often like orphans, and help them learn how to work together. Like, how do you play together in a way that's healthy and constructive and going to do some good things together? So that's Jane Addams. She had a few of those students who were like, well, these are really cool exercises and programs and things that she's doing. What if we borrowed some of these exercises and started just doing them as a way to create theater on stage? And one of these students, Viola Spolin, basically goes on to be one of the founders of what we think of now as improv theater. Then it gets all the way full circle where it kind of is like rediscovered in some ways that, oh, okay, these things that these improv artists on stage are doing, those would be really valuable skills off stage as well. And so then we bring it back into the medical space as a way for people to borrow these theater games and exercises as a way to practice like communication and collaboration. There's a woman in Chicago right now, Katie Watson. She coined that term, medical improv, and wrote some of the original published research papers about how you can use improv as a tool to teach people communication and collaboration skills in a healthcare setting. One of the people I get to work with is Dr. Diem Vu, and she, before I was at Mayo, took an improv course, and she has told me that improv was one of the most valuable tools that she brought into her practice. And then when I started this work here at Mayo, she wanted me to come and bring that to her surgical residents because she felt like this was something that she wanted to share with the folks that she was now in charge of leading.
It also just makes it clear this isn't a silly new experimental way of trying things. This has a long and storied history, but I just want to make sure I understand this correctly. You aren't working directly with patients. You're working actually with physicians, nurses, and staff and medical students. Isn't that right?
Yeah. So the bulk of the work that I am doing at Mayo is in the space of education and training for medical students, doctors, nurses, allied health staff, anybody at Mayo that would benefit. And so a lot of the work that I'm doing is using some of these theater skills to help people discover different ways to talk to each other, to listen to each other, to be adaptable when something unpredictable happens. In some ways, I think about this as like it's cross-training for healthcare professionals. Like right now, so I am actually training myself for a marathon right now, which means that I'm like doing all kinds of running. And at the same time, I'm also lifting weights and doing these different things. there's a way in which we think about this work that I'm doing using improv as a cross-training for the communication, collaboration, creativity skills that we want healthcare professionals to have. Bringing in the humanities is a way of exercising different muscles, maybe, that are stretching some similar things, or approaching some of the really valuable, important things we want them to learn in a totally different kind of way that gives them a different way of thinking about how do we do this work and do it really well.
And is there a specific problem that you're trying to address when you're working with medical staff, with doctors and nurses and so on? What is the goal in all of this?
This is a Mayo Clinic podcast, and I'm working for Mayo Clinic. So, of course, I'm biased to say there are no problems. Everything's great. No, I do think that there's a number of things that it helps you with. And these are not unique to Mayo Clinic, right? These are just things that we see anywhere in the healthcare space. For example, we know that there's a complication sometimes in how our healthcare professionals are listening to patients and to each other. And this is sometimes a byproduct of the fact that a doctor, a nurse, a healthcare team might be meeting with dozens of patients in a week, where we maybe hear the same thing over and over again. And our brains just automatically kind of go to a place of, oh yeah, I know what this is. I know what this is. And there's a part of our brain that stops listening as deeply as maybe we want it to do. And so there's one way in which this improv training is helping us stay present and keep listening actively. Like, you're meeting with the patient and you're like, I've seen this 1,000 times, but your patient hasn't seen this 1,000 times before. This is new and it's novel to them. And so as healthcare professionals, it's important that folks are walking alongside the patients that they are serving, not getting too far out in front of them, but actually being there listening as this patient is sharing for the first time, maybe, like, this is what's going on. And that moment of connection is really important and valuable for patient outcomes and for how patients feel and feel seen in these experiences.
And how can this approach work for teams?
How healthcare teams work together is incredibly important in this. I was brought in to run a workshop for a team of surgical residents, specifically to try and train them in how do you deal with things that come your way that are unexpected. And we have a whole variety of improv exercises that train us in how to do that. And so we did that for a couple of hours in a workshop. And then we took this group of surgical residents and we put them into the simulation center where in the middle of the scenario, something unexpected was going to happen. And they, as a team, were going to have to lean on each other to figure out how to deal with this situation. And that is something that requires a lot of mental flexibility. It requires a lot of trust between the team, and it requires really clear and open communication for people to be able to know who is doing what and when. Like, those things allow us to pivot and move in a really high stakes, difficult situation more quickly, in a more connected way, and in a way where we're doing it together.
That sounds incredibly useful and not at all like I think some people might be imagining when they think improv theater, like, all right, somebody yell out a word related to the season that we're in.
I have a joke where I'm like, what is medical improv? What it is not is, can I get a suggestion for what surgery we should do today? I think a lot of people, when they hear improv, their brain goes to, well, this is role playing. And actually, there's very little like that we're focusing on. I just invite people to think about, okay, you're in a healthcare situation and all of a sudden there's alarms going off. How do you self-regulate and maintain, I am calm, collected, and I can move through this situation because I know that I can adapt? That is a kind of mindset that requires practice. It doesn't just happen automatically.
All right, we're going to dive in a little bit more now into what you're teaching these students. one course of curriculum you have is serious play, learning from improvisational theater to deepen therapeutic connection and collaboration in medical settings. What exactly is that?
Serious play in the class that I get to teach through the med school, it is 8 weeks, and we get to go through different improv exercises that are training these different skills. We get to go in a whole variety of different directions. We get to spend a whole period of time on nonverbal communication, which I think is a really valuable and underrated, perhaps, part of communication. And we get to build and scaffold the education over that period of time.
Can you give an example of what one of those lessons might be?
Let me do the nonverbal communication one, because I've had a lot of students say that it's a really valuable piece of this. So we are all communicating nonverbally all the time. So if you don't believe me, go and look around at people, and you are going to read all kinds of different things into their facial expressions, how they hold themselves, just the energy that you are experiencing when you interact with somebody. Are they happy to see you? Are they excited? Are they calm? Are they nervous? We can sense all of that before they ever start speaking. We spend time in serious play practicing non-verbally. What do I want to communicate? How do I want to show up when I walk into a patient's room? Because I would be very uncomfortable if my doctor showed up in my room and looked like they were very nervous or they were very upset or something like that. At the end of the day, usually where we land is that most of us probably want to communicate, I'm calm, collected, I am paying attention to this other person. And we can hone in on that by flexing some of those muscles, practicing different ways that we hold ourselves, different ways that we use our facial expressions to show up and connect with and communicate with another person. And this leads to folks thinking very differently about literally that moment right before they walk into a patient's room. When they've got maybe their hand on the doorknob, taking 2 seconds to be like, all right, how am I holding myself right now? What is my facial expression communicating? And how do I want to enter this room and show up? Because you are going to communicate something when you walk into that room. And so you may as well make the decision that you want to make about what that communication is.
Now, obviously, there are benefits to what you're teaching, but I'm guessing that some people might think, improv, this isn't serious work. Have you run into resistance? And if so, how have you dealt with that?
Yes. It is something that people start out skeptical, but at the end of the day, I always say, wouldn't you like it if you knew that your healthcare provider was as trained as possible in being a good listener? And there are times when some supervisor or something will bring me in for a workshop, and I will walk into this space, and there will be a lot of crossed arms and a general sense of what exactly are we going to be doing for these next 2 hours, and why is this a good use of time? I will say that I have a hard time thinking of a workshop that we didn't end up in a place where virtually everyone at the end was like, I get it. I get why this was valuable and useful.
Would it be possible for you and I to maybe do one of those exercises right now, where you can maybe put me in the shoes of one of your students?
Yeah. Let's do this. So one of the key things that we teach in the class is a pretty basic but really fundamental improv concept. So we're going to just have a quick conversation, but basically we're going to go back and forth with each other. But in this first round, the first 2 words I want you to say are no, because no matter what I say.
Okay.
I'll get us started. So no, because I think that this podcast, we've spent enough time here and it's time for this to be over.
No, because there are so many more questions I have to ask, and I really think it would be a shame to cut this short.
No, because I think you've gotten everything that you need out of me.
No, because I believe that you have so much more to offer, and I think it would be so useful for you to share it.
No, because I feel like I've talked too much already here.
No, because this is something that you and I both are invested in. We both love Mayo. We both love patient care. No.
Exactly. Okay, great. So just remember how that felt. Let's flip that and use what the improv tool is. And one of the key things we teach, which is yes and.
Mm-hmm.
We can do a similar conversation, but we'll have it be the first two words that we say are yes and to each other. So, yes, and I'm actually looking forward to talking some more with you here.
Yes, and I have so many more questions, and I know you have a lot more to offer today.
Yes, and I actually am really excited to talk more about this work and how it even bleeds out into a whole bunch of different parts of the system that we haven't even talked about yet.
Yes, and I am so excited to hear more examples and more exercises, more things that I can visualize being in your classroom doing.
Yes, and like more questions about exercises are great because then we can really like demonstrate this for folks who are listening.
Yes, and
yeah, see, this is great. Yeah. So yes and is this really core improv concept. And this is an actual exercise we do in class. And we do it this way because we want people to see how much changing those two words can change how we interact with somebody else. And it can change the tone of the conversation that we have with somebody else. And so as hopefully you saw it, like when we do No Because, it was very nice No because you were still very encouraging to me. And yet, like, because I kept saying no to you, we kind of ended up in this argumentative space.
Mm-hmm.
We just kind of went back and forth and it was just, no, this isn't going to work. No, this isn't going to work. Mm-hmm. Versus when we say yes and to each other and we use that as both the actual words and the mindset for how we approach this, we end up in a place where we are collaborating, we are moving something forward, and you can hear that the energy and the excitement and the tone of it changed. Mm-hmm. And so we train folks in using yes and as both a tool for interacting with patients, thinking about how and where can I say yes and to my patients as a way to engage with them and have a different kind of conversation, as well as like within a healthcare team. Obviously, that's not always going to be the right answer. If that's kind of where we start, we're much more likely to end up in a collaborative space with our team members and our patients. And we're much more likely to be in a mode where we are listening to the other person really well, because we have to be if we're going to really actually say yes and to what they say.
How have your students been affected by this improv education? Have your students given you specific examples of how it's transformed their practice?
So I had one student who took my serious play course a few years ago, and then he actually had the notion to bring that same training and tool set to other work that he was doing in a field called street medicine, which is providing healthcare services to the unhoused. And as you can imagine, providing healthcare in unhoused settings is a situation where there is a lot of unpredictability and a lot of unknowns. And so being flexible, being able to think on your feet, being able to adapt, and also being able to listen empathetically and compassionately to the people that you are there to serve is incredibly important.
Yeah.
There's another quick one, which is I had a student who took the improv course with me, and she graduated from the Mayo Clinic Medical School last year. And she came up to me afterwards and she said, I just want to thank you for the class that we did together. Throughout my time here as a medical student, over and over again, we would be in high-stakes situations or difficult scenarios. And my fellow students would always look to me and they would be like, you're always so calm, even when like it's really stressful and really difficult. How do you do that? And she would just tell them, because I took an improv class. More than anything, that class had helped her realize whatever comes my way, I can adapt and I can figure it out. I know the science, I know the medicine, and what the improv part is helping me do is just learn how to apply what I need to apply in that moment, think on my feet, and not get overly anxious or nervous in those moments because I know I'm going to be able to figure it out.
Are there other topics your courses have covered that you find really valuable?
One thing that we are working on right now and developing is a training that we're calling Care Unscripted. And this is a partnership between me and Angela Lundy, who works in the Center for the Study on Aging at Mayo Clinic and works specifically a lot with folks who have dementia, Alzheimer's, or other memory diagnosis. Mm-hmm. And Angela and I are working together on building this Care Unscripted training to provide caregivers of people with a dementia, Alzheimer's, or other memory diagnosis some of the tools that they need in order to do what they need to do while staying connected, maintaining a relationship with this other person, being a good listener, and ultimately being really empathetic. And that's not easy.
Can you walk us through some of the things that you're trying to impart on your students when it comes to entering the space with a memory patient or a family member who may be seeing the world differently than the world maybe actually is, or maybe they're living in a different time in this moment?
100%. And I'm so glad that you framed it that way, of that the people that we're talking about who have one of these memory diagnoses are experiencing the world differently. Mm-hmm. Because our mind goes to, well, they're wrong, or this is incorrect.
No, Grandma, I'm Mary. I'm not Francine. I'm Mary.
And then that puts us into a mindset where we feel like, oh, it's our job to correct them.
A perfect example of no, because.
Exactly. And so instead, if we can just even adopt that mindset of they are experiencing things differently than we are, and I want to try and understand and maybe for a moment step into that world the way that they are, that is going to smoothen the way that we connect with them and make that a lot less painful and a lot less difficult. I'm not saying that it's not going to be difficult. Yeah. And yet, going back to the exercise we did earlier, the yes and exercise, somebody with a memory diagnosis says to you, hey, today's my birthday. And you want to say, it's not your birthday. Like, no, it's not. That generally doesn't actually accomplish very much, right? Like to argue with that person about whether or not that is true. Rather, is there a way creatively where we can say, yes, and I am so excited. Today is your birthday, and that means that we are going to get to go out together and go to lunch together, and I'm really looking forward to that. And now we've pivoted to having a different exchange with this other person, and it allows us to focus on what really, I think, is most meaningful and matters in that space, which is the connection and the relationship with that other person. That's what we care about the most.
Do you have any hopes of crossing over into working more directly with patients?
I would love that. Yes. So a couple of things. I think, yes, I would love that. I mean, we talked early on about improv is not just about being funny, and the trainings that we're doing are not focused on making people laugh or being humorous. That all said, I think that there actually is a tremendous benefit for people to find ways to laugh together, to have fun together, to play together. I think that that would be really valuable in a patient setting as well. And then the other piece that I'll just say is that we've gotten a little bit into a field of using improv performance as a way to engage patients and community members generally. So we've done a couple of experiment type events where we've had a community performance where we are going to invite people to talk about a healthcare issue. And then we have our team of improv performers listening to that. And then they do a show reflecting back to the community. Here's some of the things that you're worried about. Here's some of the things that you wonder about and you don't know. Here's some of the things you want to hear from your healthcare professionals. And there's a way in which bringing that to life on stage is a processing mechanism. It gives people a way to talk about and then hear and think about maybe what is a heavy or difficult subject sometimes in a slightly more approachable way. And it opens up a way for healthcare professionals to hear differently, like what patients or future patients are thinking about and want to hear and want to understand better about how a particular healthcare situation might work. And it's something that I am really excited about, the potential of using the arts and the humanities as a translation understanding tool for really making this all connected and, as the name Humanities suggests, very human-centered in everything that we do.
Wow, what a beautiful note to end on. I think everybody listening to this conversation is thinking, maybe I should take an improv class. So thank you so much, Tane Danger, for joining us today. Thank you for sharing your humor and your insight and your wisdom. We so appreciate it.
Thank you. This was really an honor.
So it turns out medical improv isn't making jokes about healthcare. It's actually about using improv exercises to cultivate skills like deep listening, working together as a team, and adapting to unexpected situations. As an artist in residence, Tane Danger uses improv to help healthcare professionals become better at what they do. And one day, maybe that work will even extend to helping patients with education and healing as well. At the end of the day, art and science don't have to be opposites. Instead, they can be two complementary sides of medical care. The humanities remind us that even though we're living through so many amazing technological advances, deep down, we're all still human beings doing our best to help and connect with each other. Okay, that's all for this episode. But if you've got a question or topic suggestion, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Health Matters episodes and resources, head to mayoclinic.org/healthmatters. And if you found this show helpful, please subscribe and make sure to rate and review us on your podcast app. It really does help others find our show. Thanks for listening, and until next time, take care and stay healthy.